new mobile and outpatient ultrasound services, they're actually designed for the stable patient that the general practitioner may need just a little bit of help or a little bit of reassurance about the disease process that may be going on, rather than a full referral. And us doing either mobile or outpatient ultrasound just kind of helps provide that little bit of support for them, and also the confidence to continue the therapy as far as what needed for the pet.
A lot of times the patients that we have here may be critical care. They may be on IV fluids, they may be on an oxygen tank, and transport is often difficult. Having them come to us would make it easier for the client and less stressful on the pet.
At the time of the ultrasound, generally the veterinarian is going to be standing right alongside of us as we're doing the exam and doing the ultrasound, so that they can actually watch the exam, look for any abnormalities that may be there, and we can actually discuss the case while the exam's actually being performed.
We already have a comfort level with ultrasound, but if I'm able to watch Dr. Presley or one of the specialists do the ultrasounds, I'm definitely going to learn every day more and more and continue to become a better veterinarian.
One of the biggest things that I try to do when I do ultrasounds is not only going through and describing what you're seeing, but then interpreting those findings, because that's more important than actually what you're seeing, because anybody can tell you, I see a kidney, but what is that kidney? What does that appearance mean in terms of what the animal's presenting for, lab work changes? It's the big picture, because their clients are paying for a test and they're using it to help make a diagnosis and to help manage, and so we need as a team to figure out how important that is and what we've gotten from it so they can make decisions.
Once the exam is complete, then we have time really one-on-one to sit down and actually discuss what the general findings were and what the options might be for further testing or further therapies that might help benefit this patient long term. It really kind of helps develop a true team approach to that patient's care.
And I think there's a confidence that they can give their owners that not only are they getting just the diagnostic test, but some of the interpretation that is so key to ultrasound. It's not just ultrasound, it's taking it to the next level of what does that mean.
So typically we're going to be doing mobile ultrasounds in certain geographic areas during the week. If we're not available to do the ultrasound in that area that day, the second option would be to actually send them to our facility for strictly an outpatient ultrasound. So that patient would come in, have the ultrasound, and then we would immediately send that patient back to the general practitioner for his continued care.
I want the very best for the pet, and I know that if I can't do it, that Upstate Veterinary Specialists is where I'm going to send them. When you send your patient there, they're receiving a service that you can't provide. It's still your patient, and it's going to come back to you, and you know it's going to come back, and the client is going to be happy.